Hello, hello, and welcome to the High Power Podcast. We are so glad to have you with us tonight. I am Dr. Jasmine Agnew, Senior Vice President of Academic Affairs and Professional Credentials, but you can call me Dr. J. So tonight we are launching our very first episode of the High Power Podcast, and I am so glad that you guys came in. Just sit back, relax, and prepare to end your week on a high note. I told you, bring yourself, bring your snacks. I got my coffee and I got my cookies that I made. I made those cookies. It's like rich. It's like, I say a cookie, but it's like a rich cracker and it's got chunky peanut butter in it. And then you dip it in white chocolate. Does anybody else
Mm,
eat those? They are
Never
so
had it.
good.
Sounds good though.
Never
Yeah,
heard of it.
good. I love them. Yes, but I brought my cookies and I got my coffee and I'm ready for us to get started. So again, welcome. Come in, take a seat, relax, and let's talk about something that really matters in our community. So, just to give you some background about why we started the High Power Podcast. There's so much opportunity for us to connect and to have really positive experiences and conversations about the good things that are going on in our profession. One of the things that I have always talked about and always told people, we have to consider how expansive and wide our skill set is. We can do so much. A lot of people think when they get a degree in health information or even a certification in coding that all they can do is just that. There are even things that you can branch off into from your base of being a coder. And we've got actually three awesome professionals to talk about that tonight. But there's so much stuff that we can do. I started out, I had my RHIT first before I went back to school. And I'm gonna just tell you, I ain't been a coder since the Bush administration. Now, can I do it? Probably, yeah. But what I do love is data. We are data governors. We're a part of that. That is a part of our skill set. So tonight we're going to get into those conversations. You'll have an opportunity to ask these professionals some questions, and I am so excited to have you all here. So first, before we go any further, let me introduce you to my co-host, Marjorie. Say, hey, Miss Marjorie.
Hi, everybody. I'm so glad to be here. So excited to meet you guys and get forward to talking with the panel hosts this week.
All right. Well, thank you so much. So first, let's do a introduction of our guest for tonight. First, we have Miss Jacqueline Bloink. Jacqueline holds educational degrees and credentials pertaining to health information management, including medical coding, billing, compliance, and the prevention of healthcare fraud. She has career responsibilities, which have included medical office, practice management, university medical school, residency department management, reimbursement, hospital corporate responsibilities for multiple hospitals, large multi-practice compliance leader, university curriculum design, and a consultant in forensic medical coding and billing. Again, an awesome, just an illustration of how much we can do with our credentials. She's published, she's a national speaker, and she's the owner of Jacqueline Bloink LLC, a forensic medical coding expert witness and consulting corporation, and the owner of the Association of Forensic Medical Coders that offers forensic medical coder curriculum, examination, and credential. Welcome, Jacqueline.
Thank you.
Next, we have Ms. Abby Telford. Abby is a dedicated and skilled medical coder with expertise in critical access inpatient and outpatient coding, charge capture, and release of information. With extensive experience in health information management, Abby is also an EPIC credential trainer specializing in health information management. She's an RHIT. She's committed to staying at the forefront of industry standards and innovations, and she currently serves as a president-elect for Iowa Health Information Management Association and is recognized as a leader and advocate for HIM professionals working to elevate the profession through strategic leadership and community engagement. Welcome, Abby. And finally, we have Miss Patricia Selman. Patricia Selman has been an icon in our industry for a long time. We knew her name when we were in school about her being the coding lady. My students knew about her. But she has a 20-year health information and mid-revenue cycle professional career focused in professional and ambulatory coding. She served several coding roles throughout her career, currently serving as Director of Coding Education. She's published coding articles, presented at many conferences. She is the self-proclaimed coding lady and a lover of the profession. She's an active nonprofit board member and people grower, and she connects to empower others. That is her superpower. So, welcome, Tisha Selman. It is so good to have you all on the show tonight, on the podcast tonight. So, this is a great example of people that are in HIM but have expanded so much. You know, one of the things that I did, I said, I'm gonna make a list of the jobs that I've had for the last 25 years. Because I talk about me not being a coder, but there's some stuff on here. I really think the universe was trying to tell me something because I started out as a coder, and when I was about midway to the job, they were like, let me put you over here doing something else. Because we don't really think this is what you want to do. Again, had been since like the Bush administration. My very first job, I was a coding specialist. And I remember I got put on like super simple cases because like for the first month or so, might have been more, my accuracy rate was in the 80s. So it was pretty bad. So I did that for a while. And then I went over to the behavioral health side, and I spent more time asking these people about their conditions that I really did gather, picking up the records to do the coding. So that's probably why they put me back over like working with like system implementation, because that was my very first job working with EHR implementation when they went live with McKesson. And so then I worked for a medical office. I was teaching at Virginia College in Jackson. Then I went back and I did SoftMed implementation and maintenance. Then I went to another place and I did McKesson. Then I went and worked at the prison for the prisons. And they had a homegrown EHR and I helped them with that. So yeah, I think that the universe is telling me, hey, you probably need to stop trying to code these folks stuff because that's not what you need to be doing. But it helped me to discover all the other things and how expansive our skill set is. So Marjorie, tell us about you. What did you do?
Oh, wow. You actually reminded me that I lasted in the prison system doing HIM for 3 days. There was a lockdown. And after it was a 4-hour lockdown. And I remember very kindly saying, thank you. I will not be here tomorrow.
Anybody coming up in here for that?
No, man, it has been really a wild ride. I did a lot of operations. So in the coding aspect of it, I was never actually a coder. I was more of the auditor who had to fix all the denials and work on that realm and push it through that way. And I worked with clinical trials and understanding new codes and the transfer codes and putting things that way, and work with Department of Mental Health and Medicare, Medicaid services, lots of different skill sets, lots of different areas all over the place just to get to training, education, and all the skill sets, analytics, love education, love the positive psychology that our ecosystem actually brings. So that's kind of more of my background.
All right, so Tisha, tell us about your background. Tell us about how you got to where you are.
Well, I thought I was going to be a doctor. I was going to catch babies, right? Like, because in school, that's what they always, when I was in school, that's what they taught us, right? They were always pushing, be a teacher, be a doctor, be a lawyer, be a nurse, and none of all the other stuff about the people that support those folks. And so I always thought I would catch babies, but then I realized I can't do death and, patient care and needles and all of that. And they said the next closest thing to that is coding. And I'm like, huh? And in the reality, it really is. And so while I decided to go to school for medical coding, I went and got a job as a medical records clerk, right? Because for me, it was important to learn the entire process, right? Before you can even get to coding it. And so I started out as a medical records clerk back in the day with the paper file cabinets on wheels and sending things up through the chutes and, walking over to the doctor's office saying, hey, sign your charts. And then I became a coder, and my entire, June to be 25 years, all of my career has been spent in coding, but I've coded hospital outpatient, ambulatory surgery, ED, pediatrics. Now I am on the provider side, and so working at a large health system supporting almost 1,900 providers. And now my team, all we do is the coding education and the ambulatory CDI. And so all things coding, but I've been a coder, I've been a records clerk, been a coder, been a supervisor, been a manager. Now I'm a director.
Yeah, I was one of the jobs that I had. I was listed as a coding analyst, but I worked for the QIO. So I didn't code it, but you sent me your stuff and I had to review it to see if it was right. And I felt like I was like public enemy number one, because I was just like, nope, you did. And but that for me was not so much as the coding part, and that kind of is going to be a segue into what Abby does. It was more of documentation and this data that's in here that don't match what you're trying to put on here. That's not right.
And I forgot that I also did 1.5 years fraud, waste, and abuse. I went to a payer and did that too.
Y'all got that together. So Avery, tell us about how you got into where you got to in your career.
I kind of was all over the place. So first I went to school and got my cosmetology license. So I actually own my own hair salon. But then I knew I wanted something more. Nursing is a no-go for me. Bodily fluids is not happening. So I actually started going for my business degree and realized quickly that some of those classes were just not also for me. So I've kind of like hopped around, but the college I was going to had this health information program, and I was like, oh, what is that about? And so I was reading about it and I talked to their director, and from there it was like, okay, this is what I want to do. Like, I enjoy healthcare, but not the people-y side of healthcare. So yeah.
The paper, not the people. I got it.
Yep.
I got it. So Jacqueline, tell us about how you got it, because you have your experience is like super extensive. Like, you've done so much, so many things. Let's talk about how you got there.
I think I'm a good example of it happens by accident, because I went to school in Michigan in the area of economics and public affairs. Married a family physician. But mind you, when I was at Michigan State, I left Michigan State with one class to get my degree. And that was in general, like geometry, math. My mind, I do math all day, but don't give me a puzzle, because I'll have to turn it around. I'm not good with shapes. So I left Michigan State thinking, oh my gosh, get married. And I married a family doctor. And the family doctor and I moved to rural Colorado, where there's like one traffic light in the whole county, So we moved there and had a couple kids. And he one day said, here, we need a practice manager. Here's a coding book, ICD-9, CPT, HCPCS. Learn it and help us. So in between raising kids and doing that, I became the office manager, did coding, billing, contract negotiations, all of that. Meanwhile, in the back of my head, I'm thinking, I'd like to get my degree. Well, who walks in one day to the office? Mind you, again, the whole county only has 25,000 people. That's it. One day, a new judge walked into our office, young judge, and his dad happened to be at Michigan State University, where I went. And he said, I think my dad could help you. He was the dean of natural resources, which housed mathematics. Now, if that's not the universe talking to you, right? What is, right? So faxing back and forth back then, not really a lot of computers. So faxed, was able to get that math class done, got my degree, went on for my master's, went on for my RHIA. I've been, besides practice management, coding and billing manager for a university setting in Arizona with like 13 coders, 3 reimbursement specialists, a corporate responsibility auditor for a 3 hospital system in Arizona, director of compliance for the largest provider group in Arizona, designed a curriculum for University of Arizona in College of Sociology for healthcare compliance and the prevention of fraud. co-presented and written articles with family physicians and published in the American Academy of Family Physicians journals on transitional care management. Was so many questions on coding. I never felt afraid to reach out to the powers to be to ask questions. So I would contact a couple of people at CMS when they were coming up with new codes and such, to the point that they eventually asked me to be a co-presenter on the topic of compliance in the Affordable Care Act with the Department of Justice, or the Office of the Inspector General. And that was in 2014. Through that, then I moved from Colorado, I moved to Arizona, and I moved to California. And then people started reaching out to me to do expert witness work and consulting. So all of this was just happened because I was open to it. I think that's the message here, is to be open, and the universe will give you so many possibilities that you thought that would never happen. I mean, what's the chances of somebody walking into a small county in Colorado that had the resources to help me get my bachelor's from Michigan State, which would allow me to do all these other things, right?
Right.
You have to be open to it, open to growing, open to changes and challenges, and believing in yourself.
Right. And that's a perfect segue into, we were once known as medical records, but the field has changed so much. While coding reimbursement is, of course, is our cornerstone, even with that, it has grown into so many other things, and how valuable we are across the entire healthcare ecosystem. So during AHIMA 24, I connected with some CA leaders to talk about retiring the word non-traditional. And, just listening to us, even though we do have some roles that are in those HIM spaces in the coding, they're non-linear. Like, it's not just straight prescriptive. There are iterations of a strong foundation in health information. So when it comes to what we are able to do, I want to start with you, Letitia. Let's talk about how we can educate the healthcare community about how expansive our skill set is and what we can do with our degrees.
Networking is always important, right? Making sure that the folks that are interested in the roles, that they're networking to learn more about them. But then for those of us that are in this profession, right, we got to be thinking about who's coming behind us, right? So making sure we're making sure we are in spaces that we're talking about the work that we do, that it's piquing the interest of folks, so that they can see all the variations to what they can do with their career. I know I'm super vocal on LinkedIn. I get a lot of questions, and so I'm posting on LinkedIn a lot to answer the questions that come in my mailbox. I'm the current president for my state. I'm in Minnesota, so I'm the current CA president for Minnesota. And so using my voice in that space to talk about, there's different ways to, don't look for the title coder. I'm a coder by trade, but I've done several things. It can take you so many ways. It's pulling in your skill set. Like Jacqueline said, she's done all these things, right? Because somebody walked in. And so it's being, like she said, being open, but it's us that are in the profession, remembering we want the profession to continue to move forward. So we have to do our part to talk about the work that we do, so that those that are seeking roles or haven't heard about what we do, they'll get that interest, that the profession stays strong. But then we also have people to replace us, because I am not working till I die.
Me either. Absolutely. So, Jacqueline, what do you think about that? How can we tell people about their skill set? I know that you said we need to be open. What are some other ways that we can connect and tell people about everything we can do with our degrees?
This podcast, also publishing, presenting. I mean, all of us, I think, are here now presenting, but many of us are afraid to present or afraid to publish. You have to, again, put yourself out there to be a member of your association, elected official of your association, write something you're passionate about, then talk about it with others. So networking, a lot of times I know I'm used to love to go to meetings, but now mostly do virtual because I work so much. But I do publish on a regular basis, and I present 2, 3, 4 times a year, and I never charge for it. So present, publish, network. I'm always eager to hear about everyone's story and
Mhm.
listen.
Me too.
Yeah.
Now, and Abby, I know you talked about how you kind of just fell into the profession. I really think that that's a great story because there are lots of people that just kind of, it's serendipitous. They just kind of look up on HIM. It's not like, I'm gonna tell you, for me, I thought I was gonna be a cattle farmer. Like my major was supposed to be agribusiness. I was going to go to Mississippi State, major in agribusiness, go to and minor in animal husbandry. I had a plan. I was gonna go to law school. I was gonna represent the black farmers in Mississippi, and I was gonna breed cattle like my granddaddy. That's what I was gonna do. And I went to Mississippi State for a Future Farmers of America competition because I was a public speaker that year in Future Farmers of America. And they took me out to that field where they had that cow that has a fistula cut in it, where you can see the stuff moving through the cow. And that was that day I said, I don't think this is what I want to do. I don't think that I want to do this. And so then I was kind of like, okay, so what do I do next? My mother, she's a nursing instructor. And I was like, well, I'll just go to nursing school. And she said, you absolutely will not. If you can't handle that cow, you can't handle these people. So she introduced me to the Health Information Program Director, Nina Scott, Mary Holly. I'm always giving credit. And that is how my career started in my trajectory. So talk about how you were introduced to HI and what you would like to tell people about getting into this field and your skill set and the benefit it is to the community.
Yeah. I think getting into it is the biggest part, right? Like where I live, I'm super rural, middle of Iowa. There is a community college about 25 minutes from me, but the closest HIM program that we have here in Iowa is 4 hours away on the eastern side of the state. So when you think of doing like a career fair or something, it's people want to do it locally. They don't want to have to drive 4 hours away. So I think trying to find a way to get them really involved in HIM is a hard part around here. So we have a lot of virtual and remote workers. But yeah, I love it. It's been great. And yeah.
So when you share your story, people don't want to be they can't be what they don't know or what they don't see.
Right.
So how do you share what it is that you do to get that interest? Or, have you been able to get anybody to be interested in saying, hey, I want to know more about that?
Yeah, actually, I have been with being the president-elect on the Iowa AHIMA board. I've been sharing a lot of things on LinkedIn and my group on Facebook too. And a lot of my friends are like, oh, we didn't even know this was a thing, And so it's been pretty cool to see my small town people really get excited about what I do. So, yeah, I think just sharing and networking, like everybody else said, is the biggest part. Joining the IAHIMA board was huge for me. I'm usually not one to step out, a small town and not many people. So that it's been really good and really eye-opening, and getting to go to the AHIMA conference and sharing, things from that has really helped too.
Yeah, that's always good. And Marjorie, tell me about you and your work. I know you do a lot of grassroots to educate people about our profession and what they do. Let's talk about that. How do you reach out and tell people? And then how do we make it real so they can say, okay, I never thought about that. And Jacqueline, I'm coming to you next because nobody thinks about being a forensic medical coder. So we definitely want to talk about that. But Marjorie, how do you talk to people and say, hey, let me tell you about everything that you can do with this degree?
I think it comes back to where we started from, because my bachelor's degree is actually in psychology. gerontology is where I actually began, and going back forth, understanding the whole cycle of life, and really working with a medical record. And the big difference and a big change in my mind came when medical records became digital and the world of health information really expanded the healthcare ecosystem. And that allowed anybody who works in health information professional, to become the pivot or the pivot point of the healthcare ecosystem, because nothing runs in healthcare without the information. So when we go and we talk to others, it is at the fulcrum of the healthcare ecosystem is the data. And that's actually where we live. So anybody, anywhere, it doesn't matter what it is, veterinary care, there are people that need data. I have put students into the zoo because they understand the medical record, because they understand the data that goes within the medical records, whether it is diagnostic, whether it's treatment, whether it's labs, it's the data. And so health information professionals live in that data space. And then you have a subset of that data in forensics coding, in analytics, in these other pieces. So we have to start to think about that. Just like doctors and nurses, there's an image or an idea of what a doctor is, of what a nurse is, very immediately. The health informational profession is that person, and we have a specialty in these other pieces. So when we go out and we reach out to educate the new pathways, the incoming workforce, the entry level, those that are pivoting careers, it's about where are you in the healthcare ecosystem now, and where do you want to go? And I think that's an important piece.
Right. I remember when I was working at Morehouse School of Medicine, we had people calling in the state of Georgia, like, do you have students that can come help us implement an EHR at the vet clinic? And when I would tell the students, like, hey, here's an opportunity, it's an internship, but it could lead to full time. They're like, that's not a data analyst role. I'm like, you can do more than be just a data analyst with your skill set. You can do lots of things with your skill set. And so, I mean, that brings me to another question. I know, Abby, Tisha, Jacqueline, you all have your coding. Like I said, that wasn't where I was. I spent most of my time in EHR implementation and data management. I found a struggle trying to get students to really open their mind to see what you can do in data. What has been the struggle for you? Like Marjorie just said about letting them know that you can move into specialty areas, especially you, Jacqueline. You can move into these specialty areas. Like if you don't have to just be an inpatient coder, outpatient coder. You can do lots of things. You can go into auditing. You can go in, you can work. The QIO don't still do it. Didn't the QIO have a recess or something? I don't know. That was 12, 15 years ago. I don't know. But you have so much you can do. I know it was a struggle for me because people had that mindset of, I have a degree in health information or health informatics. I want to be in data analytics. I'm applying for data analyst jobs. And I'm like, but what about healthcare project management? What about EHR implementation? What about this? What are the struggles that you all see when you talk to people and you try to explain to them, hey, you can do something else besides just one thing? Whoever wants to take that one.
Well, I think they're scared. I think people are scared to move out of their box, move out of their lane. So they're afraid to try different things. Maybe they tried change before and they failed. So I think it's a matter of getting over the fright of changing, and know that if you do make a change and you succeed, that you could be happier and more well-rounded as a person and as a professional.
I would say, I think some folks aren't pivoting, or they're entering thinking about coding because you got this social media hype that, you can become a coder, work from home, and make, 6 figures out the gate with no experience. And that is false. Unless right? Now, if we was talking maybe 20 years ago with, like to Jacqueline, like they pulled her in and had her doing stuff but she already went to school, had the experience in the background, right? Back, many years ago, yes, you can get that on the job training and then go back to school. Today, that is not the reality. And more of us in this profession need to be transparent with the folks that we're encountering when they're talking about where they want to go to. Coding is a profession. Coding is not a job, right? So it's not easy to get into because, as Marjorie said, we're dealing with data. Imagine thinking about all of us have the same thing in common. We're all patients. Imagine the person dealing with your records, right? And so it takes a really strong individual with attention to detail, a commitment to their career and all of that to be in these roles. And once you discover that this is your profession and you enjoy it, then you will become interested. If you're not one of those people that are afraid, because some people are afraid. Some people don't like change. They like comfort. They like that security. But then you have some folks that when they find their profession that works for them and they love it, they stick around and they get interested in other things. Like, what else can I do with this? You can go over to Charge Master. You can go work for the government. You can go work for a payer. You go work at an attorney's office. But if you're only looking for coding jobs, you won't find those roles because that's not the job description posting on LinkedIn. LinkedIn got it labeled as a legal something else.
And you'll miss it because you're looking for something very prescriptive instead of looking at skills or looking at what you can do or that specialty area. You're just looking coder. Like that's it. No, you got to look more for what your skills are. What can you do with that? Yeah. I was talking to somebody the other day about coders getting into data analytics. And they were like, what does coding have to do with data analytics? And I was like, pull up a chair. Let me tell you. Let me explain how. You can run reports. Look at service line offerings. What's making you money and what's keeping you in the red? What do you need to, looking at your service line, looking at the diagnoses that come through, do you have a population, a larger population with a certain diagnosis, but you don't have the doctors to provide those services? So you're losing money because they got to go 60 miles up the road. Well, then you need to probably put that in your hospital so you can bring that revenue to you and not send it up the road. Oh, I never thought about that. I know, because you got to open that mind up and think about all the things that we can do. So, I really, that is my passion, that education of letting people know you can do so much with, if you get that associate degree in health information, if you get that bachelor's degree, even if you get the certifications in some of these cases, depending on what you want to do, it is like a leap, it's like a launch pad for so much other stuff that we can do. So I want to hear about forensic medical coding. And I do see we got some questions coming in. So we will make sure that we get some of these questions answered tonight. But I want to hear about forensic medical coding. I'm interested in that because I'm that kind of nosy. Like, I want to know.
It's fun. So how I got into that was actually, and by forensic medical coding, I'm an expert witness, which means I testify in court. I have depositions. I've been in like 202 or 203 depositions, about 40 court cases. My first expert witness case came about because I was open to working with CMS and the Office of the Inspector General for that webinar back in 2014. That webinar is still on the internet today. So an attorney out east found me because he was looking for a compliance expert witness. Googled it, found my name, asked me if I'd be interested. I said yes. By being interested and open to other things, puts you out in the universe. After that, more attorneys started contacting me, and more to the point where that's what I do now, So forensic medical coding is mostly I work with attorneys, both defense and plaintiffs. So defense being the one that is defending an action, the plaintiffs attorneys that are working on the injured person, for example. I also work on some criminal cases for healthcare fraud. I'm a certified fraud examiner. It's one of my credentials. So forensics is looking into things and seeing what's right and then comparing it to things that are abnormal or wrong on a CMS 1500, on a UBO 4, looking at place of service, looking at modifiers, all these things, looking at diagnosis with CPT code that matches or it doesn't match, it clashes, then being able to explain your thoughts in a report and explain it in a deposition or at court. I absolutely love it.
I would love that too, because I'm that kind of nosy. And I'm telling you, that's why my production was so low when I was trying to code, because I'm up in the screen like this.
Mm-hmm.
Huh? That don't make sense. I don't think that's not right. That's
Mm-hmm.
why my time, I never made production. Like we had 20 inpatient charts to do a day. And this was in the paper record world. So that lets you know how long ago this was. I never made it. I never, because I was all, they don't make, I don't make this the whole time. But I think that is an awesome area. I love that. I think that more students need to get into that. So I got a question for you, Abby. You know, you're in the state of Iowa. There's only, I think, 5 programs. Actually, you have fewer than 5 active HIM programs, but there's still a need for highly skilled professionals. I mean, not just where you live, but just outside. You know, when we think about, you know, this being somewhere with something they can do and where they can work, how do we reach those that may not know about HI and how we can expand the profession? How are we going to in your area? I know you talked about your school being 4 hours away. You know, Martin and I, hey, have students, we'll travel, we'll come visit them, we'll come talk to them about it. But what are some of the ways you think we can do that? And then coming to Minnesota, Tisha, what are some ways that we can help to spread the message of what HIM is and what HI is and what we can do? So, Abby, how do we do that in Iowa?
Yeah, so when I started on the IAHEMA team in 2018, we had 5 KHIM accredited programs. Today, we have 2. They're both on the eastern side of the state. You know, and Iowa can take, 6-7 hours to get all the way across. So we're talking like Omaha. Those students are, I don't know where they're going, honestly. They're probably doing online programs. But so I think some CAs have really good luck doing career fairs. I don't know that Iowa is one of those. We do have some members that go to the career fairs, but I don't know how much it's really pushing people. So honestly, I think I would really love to see some kind of a social media campaign with AHEMA, maybe where we can pull different members that have different jobs in HIM and they can share some details about their jobs, where they work, what they do, job statistics, data that they do. I don't know, maybe we can get something like that going at,
It's already
25 in Minneapolis.
It's already in the works. We talked last week about needing that for our students. I got that from some of the educators. Yeah, it's already in the works.
Perfect. Yes, I'm excited for it.
And yes, Abby, we would love to kick that off when you all come to Minneapolis in October for our AHEMA conference. So yeah, get it together, Dr. J. So when y'all come to Minneapolis in October for the AHEMA conference, you can announce it there because we'd love to be a part of that. But similar to same as what Abby has already shared, I would add on that employers should be a space that folks will learn about that too. That's a space that we've talked about, with MNHEMA, how do we better, because we'd have a great collaboration with our state schools and things like that. But we know that there's opportunity there with the employers, there's opportunity there with job fairs, getting into the middle and high schools, right? To even talk to them so that they can start to see a different viewpoint of what they can do in healthcare. Because as Marjorie said, you can't do anything almost in any profession without HI, but folks don't know that, right?
Right.
Because we're not out front and center because we don't have to be. And so folks are forgetting like all the things that it takes to run a place. I'm a huge advocate. Any employer I've ever worked for, I always reminded them, like, you know, this place don't run without us. We're like the heartbeat of the organization. You can't dispose of paper of any kind, you know, because there has to be a policy for how you dispose of stuff. And so it's getting employers that to be more engaged in supporting the growth of their staff, right? When folks are saying, I want to go into leadership, or I'm interested in something else, or we're talking about employee retention. Where can I see myself going? So if you're showing, you know, you're sharing that, hey, here are some different roles you can do. Here's the criteria. You know, it can be a short-term or long-term goal for you, but here's some things you should consider. Here are the various opportunities. That's a space that's untapped. Job fairs, where folks are looking for jobs. We know they're there to get a job, but maybe they haven't found a profession yet. And so having booth space at job fairs saying, I know you could try to solve an immediate problem. You need to work, but can you also, you know, here's some opportunity to consider going back to school and doing these things in spaces where there's gaps. Folks that do well remote can do online courses. Your challenge will be with the folks that need in person. I don't have a solution for that because I can balance both. You know, you put me in a room with people, we might go over time. I talk too much. But if I take a class online, the class is going to stop on time. And so it's finding the space for folks that don't do well virtually. That is where there's a gap in solution.
Yep. One of the things that I've always talked about is personas of students. Students that do well online, students that do well hybrid, students that do well they have to be on site. Students that are in a certain age group, you know, the 18 to 24, that's pretty young, they're still trying to find their way. Then those the early careers. Then we've got the people that this is their second career. Then we got the people that they're really they may have been in clinical care and now they're trying to transition into something else, whether it's because of their body or their burnout. Then you got the students that are, I'm able to go to school full time and dedicate to my studies. And then you got the ones that I can only do part-time. So how can I get this? How can I meet my goal part-time? We have some students that have the time to invest to doing a whole 2 years or 4 years. We got others that are in need of a life change. They need to do something that is maybe a 6-month, 8-month, 9-month coding program to get them a coding certification so they can go to work. You got to look at the different types of people that you're meeting and how do we meet the needs. And what it does is it opens up a pipeline. Because if I come in and I meet you and you're like, you know what, I really don't know what I want to do. And if we market it properly and we say, hey, let's do this micro-credential. I'm going to just give you a taste of this and you tell me if you like it. And if you like it, come back, let's talk about it. They do it, they like it, they come back and they say, I really did like it. So what can I do next? Let's talk about a 2-year program. They'll go back, they'll do a 2-year program. They do their 2-year program, then they do their RHIT, and then, you know what, I like this. I would love to get into more leadership role. Let's talk about a baccalaureate degree. Do you want to do your health information degree or do you want to do something else? We want them to do the baccalaureate degree. So they do the baccalaureate degree. They take their RHIA. I have students to come back and then they'll say, you know what, I really like that. I think I want to look at a master's. And Marjorie can tell you, I was one of those that I will harass you from the time you enroll to the time you get out. We had students that came in that were in a coding program. By the time I left, they were saying, you know what, I think I'm gonna go get my master's. And they went on to do they went to do a bachelor's degree and on to do a master's degree. Why? Because I want you to see the value at every level and what you can do in this profession with every one of these degrees. You can have an RHIT and be like Abby and do amazing work. But if you want to go on back to school, you can do that too. There are lots of things that you can do, but there are also some people that have a CCS that can outcode all of us, because they learned that part of the profession. So it's all dependent on what you want to do. But the presentation I used to give about all the places you can go, I talked about all of them. Where you start is not where you have to stay unless that's where you land. Unless that's where you want to secure your footing. But if it's somewhere else you want to go, use every step like a lily pad, like a launch pad. And you go until you get to where you want to go. When I started, I wanted to breed cattle. And what am I doing now? education, and not just education, but trying to support educators and support students to find their pathway. Never would have imagined that 25 years ago, riding on horses and out in the pasture with my granddaddy's cows. But that's what we're doing now, and I love it. I love every bit of it. So we do have some questions. So let's answer the questions, and we're going to circle back and we're going to tell people about what they can do with what they have. So let's get in here to the questions. All right. Coding doesn't necessarily require a degree, but is a degree necessary to expand your role away from production coding and CDI positions? So I want to hear from all of you. Tell me, what do you think? I'm going to sit this one out because I ain't no coder. Don't ask me.
I can go first, being that I still have a staff that's reported up to me. I would say absolutely, but I will also be cautious to say it will vary depending on where you live, right? If you have the experience and this position has been posted forever, and the only barrier is you not having that degree, but that's a high need for that market, and they haven't found the right fit, you potentially could get in, but you still, even if you get in, you should still go get that degree. If you're thinking about future and really what's your ultimate goal for yourself. If you just want to code, then stick there. But if you want to explore all the potential options, then you want to make sure you set yourself up for those additional things, because there are things outside of the coding certification that you need to be successful in those other roles. Do you have people skills? Do you have soft skills? Do you have leadership skills? Those things you naturally can come to you, but you also can get that in coursework that helps you be successful as you continue to grow. So I would say absolutely. Do that, and you don't have to do it in any certain order, because I did mine in reverse, but I strongly encourage it.
All right, Abby.
Yeah, just kind of a piggyback on that. I can say I've seen firsthand where a role has been open for an extended period of time, and facilities do just kind of start looking for any human that might fill that position too. They might have some kind of medical background. They might know the EHR, maybe on the clinical side. Just be cautious, because if they sign that person up and say they just put them through a basic coding program, one of the 6-week ones, just to give them a nudge in that right direction, at the end of the day, the cleanup on the back end is not going to be good. So I would fully push for somebody to, go get those degrees that they need.
All right, Jacqueline, anything to offer for that one?
I agree. I mean, more than a degree, your credentials stem from the degree. So the RHIA, you have to have the degree. The RHIT, you have to have the degree. Now, you can be a CCS or CPC and just have a coder credential, which is fine, but a degree behind that will get you more places.
Absolutely. Marjorie?
Yeah, so I'll respond more on the educator side of things. So you're right. The coding doesn't necessarily require a degree to get in, because you need a foot in the door, and it's a great way to get in. But what you talked about earlier was a pathway or a pipeline to leadership and success throughout your whole career. And as you can see it, you'll start to see kind of what Tisha said, was that, hey, the next level up, if I'm going to level up with financially and in my career path, I'm going to need a degree. And so in order for you to get the financial support that you want for your own lifestyle, you need those things, because the industry as a whole, financially, you want people that also have shown the dedication and the commitment to a long project like a degree that has the theory and your experience, which is the application of that degree to move forward in your pathway. So it's a great way to get your foot into the door, But for true financial success, as you go along the lines, you're going to need that because that shows mastery of skills and mastery of higher complex of thinking.
Right. And then for me, like I said, I didn't do coding. I had my RHIA, but when it came to me working with systems, they looked at that CAHIMS and then the CPHIMS. And when it came to me working with even teaching business intelligence and data analytics, they looked at the CSBI. They didn't look at my RHIA as much. That RHIA was foundational. The Masters in Health Informatics was foundational, but to be a real, for it to be indicative of my specialty, they looked at those other certifications. So does it require a degree? Not necessarily, but will it help you to expand? Absolutely.
And
Absolutely.
employers too. Let me just interject that when I was a director of compliance, our CEO, and this was the largest provider group in all of Arizona, the CEO required all directors in that organization to have a master's. He didn't care. You could have a master's in art. You could have a master's in archaeology. It showed him that you could start something and finish it.
Mhm.
So degrees are important.
Yep.
Yeah.
Absolutely.
It's a gateway. That's exactly it. It's a gateway. It's just a gateway to, you hit that glass ceiling. You need to get past that glass ceiling. And the degree is just one way to go click, click, click. Whoosh.
And I'm glad Marjorie said the other part, money, right? You will, folks, the other transparent piece, you will max out if you stay in that role and don't further develop and grow and all of those things. So if you're fine with that, fine. But when, right, you feel like I should be moving financially and I'm not, you could max out if you don't continue to develop and pursue further education to move you into other roles in the profession.
Okay. So let me see. I had another question. All right. I said, oh, well, this wasn't a question, but this is what we talk about, letting people know what they can do. She said, Christy said, I'm an HIM student and find it hard to know what avenues you can potentially go. I was not aware initially of how much diagonal movement there can be. I think having more information about the possibilities would be helpful, which we're hoping to expand on that and share that not only with students, but also with existing professionals that may not know what untapped potential they have. She said, Dr. J gave me the excellent potential path to explore on LinkedIn when I posted about interest in data visualization and analytics a few months ago, and it opened up avenues for me. Because I tell people, you got to think about what you can do with your skills, not just what the degree is and the letters behind your name. What do you know how to do? We are cognitive. We're highly cognitive because we're thinkers. Like I said, we have to use unstructured data to come up with codes and come up with ideas and identify trends. But we can also go in and do things. We can build those systems. We can build those clinical decision support alerts. We can do all of that. It is highly skilled and highly cognitive. You just have to know what avenues are available. All right, so I just got a text. Somebody is having trouble. They can't get to the chat. Say it with me. We love technology. We love technology. All right, so I'm going to put this question up here for us to answer, and then I am going to, this is for Jacqueline, and then I'm going to see if I can help this educator.
So this question's for me right here?
Mm-hmm.
Okay. If you already have an AHIMA credential, including coding credentials, what would be your suggestions on how to get started with forensic coding? Well, if you want to do forensics, it depends on what type of forensics. I mean, if we go all the way back to the 90s, forensics started with compliance and the Office of the Inspector General and the 7 elements of compliance. If we look at NCCI edits, that's forensics. What's unbundling or, improper procedures matched to procedures. So see what you like. You could work for a payer in their fraud, waste, and abuse section. You could work with an attorney's office on bill review for litigation cases. It's using what skills you already have and your credentials that you have. Not necessarily, maybe there are compliance credentials you could get, but using your skill set, what you already have, and deciding what you want to do. Healthcare fraud, abuse, look at the Office of the Inspector General's website every day. I get a little blast and it tells me who's been convicted of fraud. Sometimes, sadly, there are people that own billing companies, for example. So anyway, all sorts of ideas. Just to get started, you have to use your skill set, do some soul searching, and decide if you want to move outside your box that you're in right now, and further your career by taking some risk and trying something new.
Right. Now let me tell you something. I'm that kind of nosy. How do I get on the mailing list to tell me who get convicted of
just-
fraud?
Yes,
Subscribe.
Dad, there was a biller today that was convicted in I think it was New York. You just go to the Office of the Inspector General and you can get their link. Just look for, you sign up for their daily newsletter. It talks about doctors, nurse practitioners, physician's assistants.
No.
Yes.
Wouldn't that be cool too, though, if, you know, all these payers actually did have health information people working for them? Because I'm pretty sure they don't, you know, like this patient is sick. Why are you, you know, you denied their inpatient stay? Why? Like, I feel like if there was actually health information people working at these places, we could get a lot more things approved.
Abby, that is one thing I am waiting on somebody to file a petition that I can help lobby. The payers have no requirement that you hold a credential to work in those roles. Some of them will have it in there, but on the billing side, it's not a requirement. But then on the on the provider and hospital and healthcare sides, right, we're saying everybody needs to be credentialed and do continuing education. And so I will get behind anybody that, you know, starts a petition and lobby for that at the federal level.
I'll follow right behind you.
Yes.
We need a shirt that says HR professionals. We keep your tail out of jail. What? I'm buying all the shirts. Okay. I'm gonna buy all the shirts. Let's see what we got. All right. Chrissy had another comment. She said, I love the idea of my credentials. I started with going to school for coding, and I'm almost done with my associate degree in health information system technology and taking my RHIT. Now I'm enrolled for my BS in HIM. I started small and just rolled into the next level for me due to learning more about the ways I can go. It is valuable learning about different experiences. Yes, you have to tell people what you can do with this. And so that's one of the things that Marjorie and I, we're going to talk about. How can we tell them everything that you can do? Maybe we need to make a list, just a running list of all of the things that you can do, and then have HR professionals just add stuff, add your jobs. I'm going to put all 32 of my jobs over the last 25 years on mine. You can do all of this stuff. I mean, like me, you probably may not be there for long, but you can do it based on your skill sets and put it down, and all of the things that you can do so that people will be able to see what this skill set means. Because here's the thing, like our skill set, we could do compliance, we could do quality, we can do performance improvement. I remember when we worked in performance improvement and quality and case management, what happened? We don't work there anymore. We worked in CDI. I remember working in a hospital and I trained the CDI. And the CDI were all nurses. Where are the HR people? Why are we not in here? Because I don't know about anybody else, but I do remember with my nose itself, if I looked in your labs and I saw that you had elevated white blood cells, and I looked on your meds and you had IV Levaquin, and I looked in your progress, you had lower flank pain and burning on urination, I'm pretty sure you got a UTI or something going on. We can pick that stuff up because of our foundation and what we learned when we went to school. We have to figure out what happened that we lost touch of how bad we are, like just smart and how much we know. Like I'm telling you, I'm trying to bring sexy back to HR. Like you got to bring it back. We got to bring it back because people just got to know everything we can do. So
you know what it reminds me of? It kind of reminds me of like when you're doing a show or an entertainment show, you got the producers in the background. They're always looking at everything and saying, go here, go here, go here. And HI has been the producers. And like we have to tell people we're the talent. We're not just the producers. We're the talent.
We are the bar. I said that in the CA town hall the other day. We're not raising the bar. We are the bar. We know this stuff. We know it, but we have to become confident in who we are. We got to sell ourselves. You got to sell yourself and what you know how to do. Because what I put in my hand, I can feel it. I can hold it. What I have in my heart, I feel it. Sometimes I go through heartbreak and it hurts me and I may lose my passion, but you can't never take what's in my mind. You can never take that from me. You cannot take the knowledge that we have from what we have learned in our programs and in this profession. They can't take that. So use it. Bet on yourself. Do the work. Let them know you can do the work. Thank you for coming to my TED Talk. All right. Most organizations, Teresa said, and Teresa Allen is like awesome. We got to get her on the stage. She said most organizations in Middle Tennessee as of today require credentials. Looking online at job requirements will give you an idea of credentials required in your area. Absolutely. Look at the credentials, but look at the skills. What do they want you to know how to do? And if you know how to do it, showcase that. If you don't, Udemy has classes for $18. Go do it. If you need to learn how to do Power BI and all that kind of stuff. But if it's something that we offer, come take it. Come do the webinars, learn about it. So you can be able to speak intelligently about what they're asking you to do. So absolutely good stuff. What was the other one that she said? Great advice. If you have credentials, apply for jobs, even if you think you're not qualified, because sometimes if organizations are needing people, they may give you an opportunity. Absolutely. Abby touched on that earlier, and I tell people all the time when they say, but I don't have that experience, or I haven't done that. If they have 10 things listed and you've done 7 of them, apply for the job. Apply anyway. The job is open. Apply. And then when you go, you got to learn how to sell yourself. You got to learn how to tell them, this is what I know how to do. And of course, this is what I can learn how to do. Because again, they may take it from your hand, they may take it from your heart, but they'll never take it out of your mind. Never take what's in your mind.
And
Well, and you're just networking too. You know, that's all you're doing. If nothing else, that interview pushed you one step further in being able to interview well. So,
right. And if you can interview well, even if they don't call you for that one, they might call you back and say, hey, we've had another role open. Are you still interested?
But what about the decision maker? Don't forget about that. Let's say you really want something. Mm-hmm. Sometimes I really want something. So what I would do is I would find out who's the decision maker. Maybe it's not HR. Maybe it's a CEO. I would take my CV resume, of course, give it to HR, then see who's the CEO. I'd find out who the receptionist is, go give it to the receptionist. Then I would email the CEO, like, just checking in, dropped off my CV, really interested in this. This is why. Guess what? I got that job.
Yeah.
Yep.
And apply for what interests you. Yeah, I'm glad you said that, Jacqueline.
I interviewed with a CEO. He then walked me down to HR, who said, who are you? We didn't interview you. Guess what? I interviewed with the CEO and the board and got a director position. So don't take no. Go after what you want and be passionate.
And bet on yourself.
Because that's important too, right? Don't just be applying to apply because you need a job, you want to get a job, right? Because there's that part of it too. Apply for the things that really interest you. Where you know you can bring your best self. And then when you go to the interview, make sure you are conveying that, right? We already have your resume. We didn't saw what you put on there. We know you got your credential and the places you worked. The interview is for you to tell me the things I don't know about you, why you would be a good fit for this team, what your future goals are. And it's okay to say, you know, I want to get my foot in the door with you. And then in 10 years, I want to do something else, because that's saying to me, you have a plan, you have goals and things for yourself. So while you're applying, make sure you're applying for the things that interest you based on the skills you already have and that you're obtaining while you're going to school. and then show up to that interview to tell people the things about you they would not find in your resume.
Right. And when they ask you, tell me about you, tell me about yourself, have your elevator pitch ready. How do you sell yourself? I practiced that thing for years. So when somebody said, well, tell me about you, I could always say, well, my background was this. This is what I love to do. These are the skills that I have. And this is what I think I can contribute to your organization. You got to sell yourself. You got to let them know what you bring to the table, what you bring to that position. All right. So it has been awesome being here with this awesome body of experts. Before we leave, is there anything that you would like to offer to those that are in attendance? Anything you want to give them our last words?
I just have to say, do not ever take the chance. Go with the change, let the change happen, and take a chance if you have the opportunity.
Anybody else?
Believe in yourself. Again, just believe in yourself, think of your dream, and go after it. I've given you a couple of examples of how I've succeeded, and you can all do it too. It's just a matter of believing in yourself.
I would agree. Always bet on yourself, for sure, because if you're not confident, then you're not showing up confident in your interviews. And secondly, leverage your employers, right? There are other roles within your organization, working with your leadership to say, hey, can I shadow, right? Can you put me in touch with the manager or director of that department? Because I'm interested in this and I just want to shadow to see if that would be a good fit. Leverage those spaces in network relationships as well, because you may have some opportunity to continue to grow where you already are.
Last thing I'd like to share is be comfortable with being uncomfortable. Be willing to try something new that may feel uncomfortable, but that is an uncomfortable stretch that might get you to the next place that you're going to have in your career. And HI is in the middle of the healthcare ecosystem, so the whole world is around you. So welcome to HI.
Welcome to HI. And mine is this: show the ones that say you can't that you absolutely can. All the ones that don't think you can do it with your skill set, show them, oh yes, I can. But you have to be confident. You have to know it for yourself, that you know exactly how to do what they're asking you to do. So for those that think you can't, show them that you can. So thank you all for your time. Next up, we got the first Friday in April, episode 2, highly skilled job search. Looking for jobs, not based on the name of your degree or your credentials, but on the skills. What do you know how to do? So we will see you next time. And thank you again for coming and ending your week on a high note with the High Powered Podcast. Y'all have a good week.